Hi, this is AINeuroCare Stroke and Epilepsy Specialist. Today we're going to talk about rapid growth of the nurse practitioner workforce and its overall implications on the industry, healthcare, and moving forward on practitioner, and most importantly, your choice of medical specialty. Now, in the last talk, we talked about why there's a sudden change, what the importance it brings, and of course, there's my personal biases as far as a neurologist and a subspecialist. And in this one, we're going to talk about how the overall market is moving towards. If you would not believe that there's a significant, massive, rapid growth of nurse practitioners within the United States medical system. It's literally doubled from 2010 to 2017. As a matter of fact, from 2017 to 20, there's even more growth, as there are some states, let's say Wisconsin, is producing more nurse practitioners than there are jobs that are present in that particular state. So people are going there for education, but eventually the job market is going to be in other states as well. Clearly, massive growth in the workforce of nurse practitioners, and rightly, it does pay a lot more, especially for younger nurses. And that's one of the things that is attractive for the younger nurses is concerned, because overall the nursing reimbursement rates have fallen because initially the nurses were more unionized, they had better benefits. I had nurses right now that are older, about 50 or 60 years old, that are getting as much pay as a nurse practitioner. However, the younger nurses that are joining the workforce are not seeing that sort of reimbursements, or even eventually seeing those reimbursement work levels after putting in 20, 30 years of work within this industry as well. Overall, there is a lot more higher interest. As a matter of fact, there are new nurses that are graduates that are joining our neuro ICUs. They have a simple stated goal that they're going to be here for 2 years, make a CV so that they can be accepted into a nurse practitioner school, and then they're going to move into a nurse practitioner period. So there are nurses from the get-go, for even going into the nursing school, are planning a whole career to get into a nurse practitioner rather than just being a nurse. So clearly a market shift in terms of nurse practitioner continuum as we see. Unfortunately, that is leading to a significant decrease in the workforce of nurses. There are registered workforce because of the nurse practitioner. There is COVID and all those other related stuff that is going on, burnout, etc., and people are not joining the industry in the first place. There is a reduced nurses that are going to be available in the workforce by 80,000 nationwide. So clearly those nurses are going to become nurse practitioners, and therefore we're going to see a significant reduced workforce of nurses itself. So that's another concern moving forward we're going to see as far as that is concerned. Overall, it's not bad as far as financial impact is concerned, because nurse practitioners generally are not doing that much weekends and nights. They have a fairly reasonable work-life balance as compared to physicians, and physicians' average pay, and these are from Department of Labor statistics, working at around $100 an hour. Physicians, assistants, and nurse practitioners are around $55 per hour. Therefore, the workforce is going to continue to increase moving forward. As a matter of fact, the physician growth will be stuck at 4% per year, which has been there for years and years. There are not new medical schools being built, but nurse practitioners are going to improve in workforce by 45%. They will be doubling every 10 years per se as far as nurse practitioners are concerned. But clearly, they're starting from a lower end because there are not enough people, but moving forward, you're going to see that more and more people are going to join this workforce as well. The growth rate in nurse practitioner is the highest of any occupation. I mean, it's about 52%. And then, of course, physical therapist, home health specialist, occupational specialist, etc. And then even physician assistant is 31%. So combination of them are within the top 10 rapidly growing professions in the United States as we move forward into the future. In the next lecture, we're going to talk about scope of practice for advanced practice providers. Thank you. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.